What's up, guys? It's Nora, and today I wanted to share with you guys that I'm going to be having surgery again in a few weeks. This surgery is not one that I thought I was going to have because I didn't know that this surgery was an option for me to have, but I'm going to share with you guys what it is and why I'm having it and how this is hopefully going to fix some problems that I've had since I was in high school. The surgery I'm going to be getting is my tonsils removed, which is going to be like the big, most traumatic part of it, which actually wasn't included in the original plan for me to have surgery, but they told me that they could do it at the same time, as well as have cryotherapy on my nerve in my nose, which I'm going to explain why after this. And then also I'm going to have some tissue, like sinus tissue in my nose removed. And I have to see at my pre-op appointment, they may be doing something with almost like reconstruction, but not really, just kind of opening my two like nasal passages from my sinus to my nose because I've been having a lot of problems with that, and there was one planned surgery and then insurance didn't like a certain part of it, so we had to like redo the plan of it. So I don't know if that reconstruction is actually going to happen or if it will just be the tissue removal, the tonsil removal, and the cryotherapy. I've had problems since I was in high school, but I haven't been at this doctor's office until last January or February when I said in like a previous video, I had swimmer's ear for 5 weeks that was undiagnosed, that they couldn't diagnose at my PCP's office, and so I ended up having to go to the ENT. While I was there, I was like, hey, any chance you could help me out with these other problems that I've been having? And they were more than happy to. My problems and why I'm having the surgery, like I already said, was from high school. As early as I can remember, it could have possibly been middle school or earlier, but in that time, I've been diagnosed with vasomotor rhinitis, and what that is it has to do with your nose, rhinitis, inflammation in your nose, vasomotor, has to do with your vagal nerve. Your vagal nerve runs through your body. It sends messages to all the rest of the nerves and does a lot of work with your nervous system and the parts that like make your lungs breathe, make your heart beat, like all those things that you don't think about. The vagal nerve has to do with. Your vagal nerve sends messages to one of the nerves in your nose and is supposed to tell your nose like when to be inflamed, when not to be inflamed because of allergies, when to be runny, when to not be runny when you have like a cold or flu, or when to pretty much make you feel like you're congested. But mine has never worked properly. I don't know why it doesn't work properly, and I don't know what causes this, or specifically why the vagal nerve has problems with my nose. It feels as if I can have a cold 24/7 whenever my nose decides it wants to. I can one day feel like my nose, and I say like congested, but when I say congested, I mean more like inflamed. So like I can feel like my nose is inflamed at any point and just feels like I can't breathe at all through it. I have a lot of problems with, especially in the wintertime, when I go inside, outside, my nose runs a ton just because of the cold temperature difference. And that's your vagal nerve saying, oh God, respond to temperature, but mine's overactive. So any single time I go outside and I had to go like into a warm building or into a warm car, I have to blow my nose. And for anybody who knows me, knows I blow my nose a lot because I constantly feel like I have stuff in there when in reality, there's nothing in there. My tissue is just literally inflamed to be inflamed. This may also be autoimmune related, very well could be, but I'm not really sure why it happens. On a good day, I blow my nose between 10 to 12 times, like on a literal good day. If not, I'm constantly blowing my nose, always first thing in the morning, always before I go to bed at night. I have tried allergy meds. Allergy meds more work in the summer, but do not work at all in the winter. It actually makes my nose more runny in the winter usually. And some people may be out there thinking, you probably just have allergies. I don't. I went to an allergist when I was in college. I was tested for allergies. I was told by the allergist I do in fact have the vasomotor rhinitis besides the already like medication and food allergies that I have. I don't have any like environmental allergies. And another big problem that I have is when I go to sleep at night, no matter what side I lay on, my nose almost feels like this tissue is just like really floppy where it goes from bone to cartilage, and it feels like it just like collapses in on itself, and I can never breathe through my nose. So I've literally had breathing problems since high school. I go through so many boxes of tissues, and I just always had this problem since I can remember, and I'm really tired of having it. But when I was in high school, I don't believe there was any treatment for it, and I don't believe I could have done anything for it besides blow my nose all day long. I tried Flonase. Sometimes it worked, sometimes it didn't. I tried the saline rinses. Sometimes it worked, sometimes it didn't. I tried all of the allergy meds. I tried decongestants. Nothing out there worked. Nothing seemed to really touch it. Because I've always had these problems, I finally had just said enough. So after I went to the ENT and have to continue going to the ENT because my ear on this side keeps blocking with wax, I said to him, hey, is there anything you can do about my nose? And he said, sure, I have this medication, ipratropium. It's usually used for like nebulizers for asthma, but he was like, we can also use it for your nose. And it worked. I was on it for 6 weeks. It worked for the first 4. The last 2, it actually caused a ton of rebound congestion to the point where I'd use it and my nose immediately would like completely congest and get inflamed and like close up. And it was actually a common side effect is like nose bleeding. It was making my nose bleed a decent amount. And so the last 2 weeks, though, I didn't know it was the medication because I thought the medication was working so well that first 4 weeks that I actually thought like maybe I'd gotten COVID from someone. Stopped taking it and I kind of waited a day or 2 and then I took it again. And sure enough, that was the problem. I obviously couldn't use that medication anymore because all of a sudden now when I was trying to use it, it just wasn't working. I was off it after that 6 weeks. I did take a week break, tried again. Once again, a ton of rebound congestion. So I just was like, well, this is frustrating. You got anything else? And they were like, here, I have a colleague. Like, why don't you go speak to them? So I went and I spoke to this guy and I thought he was just gonna maybe promote the cryotherapy, which is pretty much to go in with, instead of like cauterizing something, like with like burning it and like burning a nerve away, which they do in medicine nowadays, they instead use a cold, I don't want to call it a laser because it's not a laser, but they use like an instrument that has a very cold freezing tip and they go in and they freeze the nerve. This works for like, I believe 60 to 80% of patients. It may work for me, it may not. That's something that is an option that I'm going to try. Usually I know most offices do it while you're awake and they just like numb you up and spray you in the office and do it, but this actual office will do it while you're just like lightly put under. I also did, prior to having the consult, go and get a head CT done to make sure I didn't have a deviated septum. I was hit in the nose pretty hard by my brother line drive when I was a kid, so I did always question whether I have a deviated septum. But he also got those results back and said I didn't. And then he also did this test where he put pretty much like these very extra large tweezers in my nose and like lifted them like sideways on each side and was like, can you breathe better on both sides when I do that? And I was like, oh yeah, so much of a difference. And it turns out that in my nose, where it goes from bone to cartilage, it's literally floppy and it's not large enough. So every single time I lay down, my nose literally collapses in on itself, which explains why I can never breathe at night. One of my problems. So then he also said I can do the cryotherapy for you. Awesome. He also said that I have a little extra tissue that more than I like should in my nose and my sinus cavity. So he's going to go in and take just some of that out. So all of that shouldn't be a problem. For that first surgery, he had also included in the plan to have these nose implants. They're called Latera. There are little plastic implants that go on each side of your nose, so to pop that open. Now he's going to, in a week or 2, I think, just open it up a little bit. But originally the plan was with the nose implants, and it dissolves after like 6 to 8 months, and then the scar tissue like leaves your nose just like open more and just prevents it from collapsing in on itself. But those have only been around for like 5 years, and Cigna sees them as experimental. So they won't approve that part. But the cryotherapy, the tissue removal, as well as maybe a little reconstructing, he is willing to do for me. And we hope that obviously that would help a large portion of my problems, as well as I decided while I was there to say, hey, while you have me under, any chance you want to take my tonsils out? So the recovery with not having the tonsils out, I could have a breathing tube, or I could just have like a nasal cannula and light sedation, and it would only be a few days. But throwing my tonsils in makes my recovery for 2 weeks long, as well as I will for sure have to have a breathing tube in, which is fine by me, doesn't faze me. And the reason I would like my tonsils out is because I have horrible tonsil stones, like popping out every day, gagging on them, pushing them out. I run, they come out. Sorry, TMI, it's totally gross. But I mean, any of my family members who have literally heard me sit there and pop out tonsil stones are like disgusted by it, but I can't help it. And they started, weirdly enough, my sophomore year of college. I just had one day and I felt like I had something in the back of my throat. and I like couldn't get it out, and then it all of a sudden like came out in the middle of a chiropractic appointment. And I called my dad afterwards and was like, is this a problem that you've had? And he was like, yeah, oh yeah, no, I get those. And I was like, cool. So the problem with these tonsil stones and why I have them so often is when you get a tonsil stone, they create these like crypts in your tonsil, and every single time you get one, it kind of expands that crypt and makes it larger and larger. So it doesn't matter once you get tonsil stones, they're going to continuously get bigger and bigger and bigger and cause you more problems. They're never going to like shrink down back to their original size because those tonsil stones over time are just enlarging and enlarging and enlarging that tissue and the hole that it's in, pretty much. So these tonsil stones are never going to go away, and they're so disruptive to my daily life, and I have so many problems with them. And I also question whether they have made my throat sore on a multitude of occasions. So I would like them out. And he said I don't need any, like, I don't even need a prior authorization to get them out. So he's willing to take them out while I'm under and just have me put under once, less risk, of course. And so that is scheduled on the 25th. I think the day is the 12th. 13 days I'm going to be having surgery. And a lot of people have been like, well, why would you want that? Like, oh, that's going to be terrible. It's your tonsils. I am so excited for this. I have been waiting to not have to deal with tonsil stones since I started having them. They are so disruptive. They make me feel gross. They make me feel like there's always something stuck in the back of my throat. And they're just so disruptive to my life. And especially my breathing problems. If we can fix that, it's going to literally greatly affect me the rest of my life. I'm not going to always be sniffling. I'm not going to be always blowing my nose. I'm not going to always have trouble sleeping because I can't breathe that night. Like, I'm just so excited. I think all of this is going to fix a lot of problems that I've always had that I truly never thought would ever be resolved. But we'll have to see if it works. And if it does, that's great. If it doesn't, I still at least get the tonsils out. And that's one benefit of me being put under. So I'm going to try and film it for you guys. I'm hoping that I get to do that. I know that I can't bring whoever drives me like in the hospital for surgery. I have to go in alone, which is fine by me. So I'm not sure. I don't think they're probably gonna let me have my GoPro, but I'll have to see like what their waiting area is and like where I am afterwards. I may like vlog before going in and then vlog like in the car. I don't know. I'll have to see like how I feel. But thank you guys for watching. Stay tuned to see an update. I might do like recovery updates and how it is to recover from tonsil surgery as an adult. And stay tuned for that. Thank you guys for watching, and I'll see you guys next time.